Right on. Hey, good morning, everybody. Good day. This is Rolando with Dental Voice Season 2, and we're with Zyris. If you had signed in a little bit earlier, we started this whole discussion with Amy Rudnick, who's an RDA at One Manhattan Dental, and because of technical difficulties, it didn't make it. But now we're back and everything is good, so I'm excited about that. So we'll dive right in here, and we'll get right into the session so that we can kind of go through. Amy, thank you so much for coming back to us here. And
thanks again.
I feel bad that that happened, but this is awesome.
Things happen. Yep.
This is, you know what? I'll bet you during the course of your treatment and as you're working with your patients or in the office, things like that never happen, right?
Oh, never. Everything always runs smoothly.
So, okay. So what you were sharing with us is you've been and continue to be a professional hygienist and have been doing this for over 40 years. And what we got into was a discussion about how in that time you've probably seen some incredible things and some crazy stuff, and you started sharing with us the context around AIDS and bloodborne diseases. The question that I'd asked you is, have you ever seen anything that kind of is anywhere close to what we're seeing with COVID now, or not? So what's
no, this is by far the most profound change in dentistry. This is totally unexpected. We've never planned for something like this. We never expected something like this would happen. So no, this is a big leap from what we were used to.
How does it compare to some of the other, what I'm going to call crises or issues that you've faced over the last 40 plus years in the experience that you've had dealing with crazy stuff?
I have to say this is the worst. This one really, knocked us for a loop. Came out of nowhere, came very quickly, and we had to come up with ways to deal with it.
How has it affected kind of what you're doing? Because when you work with One Manhattan Dental, and one of the things that we've learned as we've spoken to Doctors Raimondi, Dr. Sclafani, your colleague Marie Ann, is that you're busy again and you're working again. How has it affected kind of the way you're dealing with and treating and caring for your patients?
Oh, it's quite different. We had to really scramble to find the best way to treat our patients, although Dr. Raimondi, Dr. Sclafani clearly took their time during the time that our office was closed to come up with every way possible to keep our patients as safe as possible. And they didn't stop researching and calling and getting everything that we needed to feel comfortable to reopen, not only for our patients, but for ourselves.
So, during the course of our Dental Voice season, we've spoken with a lot of clinicians, and one of the most common comments that we've been receiving is anxiety around and fear with regard to, oh goodness gracious, am I exposing myself? Is there the potential or possibility that I may get this and spread it? How do you feel about that? And what kind of went through your head as you were, preparing to come back? And now what's going through your head that you are back?
I was terrified to come back. It was, the whole thing was daunting, particularly since I'm here in Manhattan, in New York, which the numbers at the time were very high, probably one of the highest in the country. And the thought of going out there and being, with my patients again, was very anxiety producing. But with the communication with Dr. Raimondi and Dr. Sclafani through the whole time that we were closed, we were communicating, they were communicating to us, and the anxiety eased up a lot, certainly, as time went on, so that when I actually went back into the office for the first time, look, there was definitely anxiety, the first few days, but we all kind of calmed down when we realized that we are as safe as we possibly could be.
It's I can't even imagine, especially given how much, I'm going to call it hysteria, how much hype, how many things were being thrown out there about who's at risk and what kind of risk and how to get it. Now that you're in place, now that you've been the office is now open, what are some of the things that you're experiencing? What are you seeing? How are you feeling about it?
I'm feeling better about it myself. I'm seeing, a lot of patients who are very nervous to come in. But I think that the way we communicated with our patients through social media, through newsletters, through emails, if they were that anxious, they wouldn't have come in the office. So I think there was a bit of safety that they felt with the things that we were doing for them.
See, and I love the fact that you took the time to not only educate yourselves, but also to take the time to reassure and then communicate with their patients what's happening.
Sure.
Right now, across the country, there still continues to be a lot of things that are going on. And one of those is, there are hygienists out there because of the fact that you use ultrasonic instruments, and then there are a lot of aerosols. And there's a feeling of, still a continued feeling of anxiety around that. What advice or what insight could you share with them who might join us here?
I think that our office was quite prepared. Aerosols was the main focus. And if you do the right thing in a dental office, doing what we're supposed to do, the anxiety is lessened. We have air filter systems throughout our office. We have more than we need. I think we have 18 systems. They went above and beyond what we needed in our office. We use the correct PPE. I use a new cone system that's attached to my high-speed suction so that patients aren't rinsing in the sink, so there's no splashback. And one device I use that I'm particularly very fortunate to have is the IsoLite. It's a device that's placed in the patient's mouth, attached to a high-speed suction, and it has been a game changer for me.
So first of all, it looks like consistent with what we've heard, multiple systems that are in there. Had you heard about our system, the IsoLite, before you ever used it?
Never. But
in your entire career?
No, and I've never heard of it. And I know that Dr. Ramundi and Dr. Sclafani did their research and found that that was the best possible way to treat the aerosols coming from patients.
Okay, so now I'm actually curious. When you first saw it, and I really would love to hear this, what did you think of the system?
I thought, how in the world is this thing going to fit in a patient's mouth? And how will my patients accept it? I have to say that we practiced on each other. Once I put it in the first time, it really wasn't difficult after that. And it is just, as I said, it's a game changer. It's, as daunting as it looks to a patient, once it's in their mouths, most of my patients were very accepting of it.
So did you have to change how you were doing stuff? I mean, we hear a lot of times that, especially with hygiene, it's difficult to work with.
The IsoLite?
Yeah.
No, I didn't find it difficult to work with. The first few times I had to, work with the patient to make sure that they were comfortable using.
Oh, there you go. You're back. Can you hear us?
Yes. I find that for me, the best part of the IsoLite, it is a tongue retractor. And as any dental practitioner knows, working with a tongue is very difficult. And that's one of the most difficult parts of, treating a patient. And with the IsoLite in place, it just makes it easier.
Oh, now there are other systems that you've also integrated into the practice. What is your experience with them? How is it feeling having to kind of add all of those other systems into, what you're doing?
Well, the systems air filter systems are sitting on our counters. The cone evacuating system is simple to use. Patients find it easier than reaching over and rinsing in a sink. The PPE is the difficult part. And I have to say, using an N95 mask is not fun.
How is that? What's your experience with that? I mean, how are you navigating? How are you getting through that?
So wearing an N95, wearing a level 3 surgical mask over that. We have shields that were actually custom made for our office. Dr. Raimondi and Dr. Sclafani worked with a company that created our shields so that they fit over our loops and our light. And so I have to say the first couple of weeks, it was quite difficult. I think we were all exhausted when we, finished work. There's a learning curve to it, but like anything else over time, it gets easier. And
right now it's kind of become a lot less onerous, it sounds like.
Correct.
So from a practice perspective, as the patients are coming in, what are the most common things that they're expressing to you with regard to coming? Do you feel that they're apprehensive to come into the dental office now?
You can tell the ones that are apprehensive. I had somebody come in with gloves, and she shimmied down the hall because she didn't want to get near anybody. And she actually said to me when I started working, "Should I take my mask off?" Which I thought, okay, this woman is quite anxious. It runs the gamut. There are people that just, they're fine. But I think there's a trust in our office, or else the patients wouldn't be coming back. With the communication that they had through the doctors, they felt safe enough to come in during this epidemic.
Oh, wow. I guess, I can understand kind of that anxiety. You're working in the mouth and you're being asked, should I take my mask off? And
exactly.
But, I guess I get it. It's interesting. There's studies out there right now, and I'd love to get your perspective on it, that show that there was an article or a comment that it was, and I watched it in the news about mask mouth and how, because people are wearing masks and all that type of stuff. Are you seeing any of that, or are you seeing any of the byproduct of people wearing masks all the time and maybe not cleaning their teeth?
There have been some complaints about, people's skin breaking out. People in general are complaining that they have to wear the masks. It's not a comfortable thing to see. I had a few patients coming in, and they were so happy to be in my office with their mask off because it was the only place they were allowed to go out without a mask on.
So it wasn't that bad. It wasn't that bad.
No, that part wasn't so bad.
So in the course of infection control, in the process of dealing with airborne disease, aerosols, you'd mentioned that. How are you navigating through, the potential for the, hard surfaces or droplets? Kind of what are your thoughts around that? And what would you say are working for you all?
Well, I think, as I said, the air filter system, the isolites are very helpful. And I can tell because when I am done with a patient and I go to clean my shield, there are no droplets on the shield, which shows that that device is actually working quite well. And then we do what we typically do in terms of disinfectant. We, as hygienists and dentists, we have always treated every patient as if there's some communicable disease that we can get. And that's that's just how we practice. This is just an extra layer of that.
Do you feel that as we go forward that it's going to settle more, or do you feel that there's going to be more and more that's going to be piled on? Because it sounds like you're doing similar but more of the same thing. Do you feel it's going to start getting more? What are your thoughts on that?
I don't know that it's going to get more. My feeling is that this may be the norm. This is just something, it's not like when this is over, which it will never be completely over. When this is over, we can take everything off. We can take off our mask, we take off our shield. I think that this is going to be the new way of practicing dentistry.
So for the young folks out there who are considering hygiene school or dental school, who are in the midst of coming into the workforce, based on the 40 plus years of experience you have, what advice would you give them, or what would you tell them with regard to what to expect, or how to kind of get into this?
That if they want to practice dental hygiene, these are the things that you have to, this comes along with the job. It is, we're dealing with patients, we're dealing with viruses, we're dealing with bacteria. That's, that's part of the deal. And just, do everything that is right for you, and keep your patients safe, and then enjoy the job after that. There's relationships that can be established through this job that are just, they're priceless. That's the part that I really, really cherish. I have friends that I've grown very, very close to just in my practice. And that's why I look forward to going back to work. So if I have to wear a mask and I have to protect myself, that's just part of the deal.
Wow. So would you say that it continues to be one of the most fulfilling and kind of enriching things you can have, if you understand that?
For me, I wouldn't be working this long if I didn't find it fulfilling. I find it, I like being at work. I like working with my staff. We have an incredible staff at One Manhattan Dental. We're very, very close. Our doctors are terrific, and we're a team. I mean, that's the difference. It's not their bosses, we're, the workers. We are all a team, and we work together. So to me, that's a fulfilling part of my job. And then there's the added relationships that I have with patients, and teaching and educating and keeping people healthy and building a trust so that your patients, listen and take your advice.
Oh, that's so cool. I will, as I've gotten to know and meet the different members of the One Manhattan Dental team, it's astounding to me, the relationship, how well you get together, how awesome that is. We're hearing out there that that's not the norm in a lot of these practices. What advice would you give people who may be struggling a little bit with that relationship, since, I mean, you have such a good one?
I think the key is that as I said, we're a team. It's not as much of a hierarchy as a lot of dental offices where the bosses tell you what to do and you're the staff. We're a team. We are all respected. All jobs are as important as each other's, and we have meetings every week. We are asked our advice. If there are issues, I don't think anybody really has a problem going forward and expressing their issues. That's an important aspect of working in a team like this, in an office like this.
That is so cool. So here's what I'm hearing: be open, be direct, talk, and make sure that you express things that you're feeling. Otherwise, you don't, and then it becomes an issue.
Then they boil up, and then things get ugly. So yeah, just be open, be transparent, be respectful. I think those are the three things that help.
Well, also, it's like all of you all at One Manhattan Dental are like superheroes. Do you sing?
Rolando, I told you. And if you asked me to sing at the beginning of this, you would have lost your entire audience. So, Marie Ann, if you're watching this, you do the singing, please. You don't want to hear me do it.
No, it's just it's the feeling that you get in engaging with the team, the context of what it is it's absolutely wonderful, and I so appreciate the kind of the message that you give out, and just the way you work together, the way you are, and the energy that you bring, that your entire group, and I love that. as we kind of bring this together, what people who are going to view this, listeners that are out here, I'm always looking to what advice, what closing words would you like to share with the community out there, with people who are going to see this, your patients who might see this. What message would you like to give them?
Well, for our patients, the message is that we're doing everything that we can possibly do to keep them safe. Their best interest is at heart, and that's what our goal is. For doctors, please be respectful of your staff. Listen to them. And as a staff member, if there are things that are getting, really irritating or annoying you, then talk about it. It just bring it forward, and there's always a resolution if there's respect amongst the staff.
That is so cool. And I personally feel it's important to listen to and listen here what people who have been there are doing. And because you've been successful over the past 40 years in your craft in treating your patients. You've heard hygienists, dentists don't just clean teeth or make beautiful smiles. They actually help the systemic health of people. And
Absolutely.
because of that, people's lives are better. And I admire that. And I really appreciate you continue doing that. And the message that you gave is great. So really appreciate. Thank you. Thank you so much. I will not ask you to sing.
Thank you very much. We don't want to hear that. I'm telling you right now.
But please, at some point here down the road, after you've had another several months, would you be willing to come back and share ongoing experience with us and things you've discovered and all that type of stuff? Is that okay?
Absolutely. Would love to.
Awesome. Well, hey, folks, a little bit of rocky start here, but hey, this is absolutely wonderful. Thank you so much, Amy, for joining us and sharing your perspective on this. I love the fact that you've been doing this as long as you've been doing, and you continue to have the passion. You continue to have the energy around it. One Manhattan Dental. If people wanted to ask you questions, what would be the best way to do that for you, Amy?
I have an email, Amy B. Rudnick at One Manhattan Dental. You can always get in touch with onemanhattandental.com, and we'll be happy to answer any questions you have.
Awesome. Hey, folks, if you like this, please share. If you have questions for Amy or you want to check out One Manhattan Dental, please go ahead and do that. Those of you who are apprehensive to potentially go to the dentist, find practices that share and are communicating with you and telling you exactly what they're doing. And if they aren't, ask. If not, find somebody else. Amy, thank you so much for joining us. So much appreciated. And please thank your kids for helping you out here. And I love it.
Hey, things happen.
You're absolutely wonderful. Awesome. Have a wonderful weekend. Please be safe. Have a great Labor Day, everybody. And we'll see you again. We'll see you soon.
Thank you.
Appreciate it.
Bye.
All right. Bye.